Hello, my name is Mackenzie Fagan-Dodd, and today I will be presenting my organizational evaluation and research proposal. My focus is on addressing substance abuse in rural communities with limited access to treatment. This presentation will examine a local nonprofit, the Butte Rescue Mission, while exploring barriers, policies, and recommendations to improve services for individuals struggling with substance abuse disorder. Rural communities face unique challenges when it comes to accessing substance abuse treatment. There are often fewer facilities and providers, and transportation can be a major issue for those who live far away from services. Stigma is also a significant barrier because in small, close-knit communities, people may fear judgment for seeking help. In this project, I'll focus on the Butte Rescue Mission, a nonprofit organization that provides services for people experiencing homelessness and addiction in rural Montana. The goal is to evaluate current services and identify ways to fill gaps in care. The Butte Rescue Mission is a nonprofit, faith-based organization. Its mission is to provide a safe space and essential resources for those in crisis, particularly individuals struggling with homelessness and addiction. Some main services include emergency shelter, meals, recovery support groups, and case management. They also connect clients to external treatment centers, mental health care providers, and offer programs designed for families with children. These services are crucial in rural Montana, where specialized treatment facilities are very limited. Evidence-based practice is essential for designing programs that are effective and sustainable. Research by Davis and O'Neill show that rural residents are far less likely to receive specialty care for substance use disorders due to provider shortages and geographic barriers. Miller and colleagues highlights how stigma can deter individuals from seeking treatment, especially when they fear judgment within their small communities. Additionally, Poland and Ozer emphasize that integrating peer and community-based models can help build trust and improve recovery outcomes. Finally, telehealth has also emerged as a promising tool for expanding access to treatment in remote areas. The Butte Rescue Mission uses a no barrier entry policy. This means that individuals do not have to provide proof of sobriety or income to access basic services that like shelter and meals. This policy helps reduce stigma and encourages individuals to seek help without fear of being turned away. By meeting people where they are, the organization builds trust and opens the door for future engagement and treatment. This approach reflects a harm reduction model, which is especially valuable in rural areas where access to services is already limited. Even with these services, there are still major unmet needs. Transportation remains a huge barrier. Many individuals cannot travel regularly for treatment centers or support groups due to lack of reliable transportation. Telehealth services are limited, which makes it difficult for clients to participate in virtual programs. There's also a lack of specialized programs for families, especially with for women with children who face unique challenges. Finally, more research is needed to understand outcomes in rural settings so that funding and programming can be better tailored to these communities. One key federal policy that affects rural treatment is the Comprehensive Addiction and Recovery Act, or CARA. This act provides funding for prevention, treatment, and recovery initiatives nationwide. While helpful, many rural communities struggle to access these resources due to limited infrastructure. At the organizational level, the Butte Rescue Mission's harm reduction approach creates opportunities for engagement, but can sometimes conflict with federal funding requirements that favor abstinence-only models. This is why the Butte Rescue Mission is purely a donation-based organization. These policies can either support or limit the organization's ability to provide flexible, client-centered care. To address these challenges, I recommend several strategies. First, expanding telehealth programs would allow individuals in remote areas to access therapy and support groups without traveling long distances. Second, developing partnerships with local transportation services or volunteer driver networks could help clients attend appointments. Third, providing a family-centered programming would address the needs of women and children affected by substance use. Finally, fostering stronger collaboration between schools, healthcare providers, and social service agencies would create a more integrated support network. Evaluation results can be used to improve services at multiple levels. At the micro level, staff can create personalized treatment plans to access or to address individual barriers like transportation or stigma. At the meso level, organizations can build partnerships and coordinate care between local providers and community organizations. At the macro level, outcomes can be used to advocate for rural-specific policies and funding to create systemic change. This aligns with the social work deposition number 6, which emphasizes practicing within our areas of competence while continuously enhancing our professional expertise. Here are the scholarly references I used throughout this presentation. These articles provide evidence-based support for addressing substance abuse treatment in rural communities and highlights the strategies for improving services through telehealth, harm reduction, and community collaboration.